A vertical mattress suture, which is used in cases of excessive tension or perhaps in the hand when you really want good approximation. You can actually look carefully in this wound for this simple. The edges are everted, but you'll see with this next stitch they'll be very well everted. It's a safer stitch to use in certain situations where you have trouble everting tissues. Again, you're going to simply grasp the tissues, evert it very gently, pronate the wrist, hit perpendicularly, and this time a little bit further from the edge than you went on that first suture. Come through, grasp the needle, pull a little bit of the suture through, evert, perpendicular, again equidistant from the incision, and pull that through. Now at this point you could either turn your body to do a forehand stitch, or else you can load the needle backwards as a backhand. So you can suture it directly away from you. In this situation, I take my fingers out of the holes. I think it's easier. Again, the same motion. You're going to evert the skin edge. This time you're going nearer to the edge, just a couple millimeters from the edge, but it's important to still get full thickness, epidermis and dermis. Reload the needle holder backhand. Pull that through a little bit. Evert the skin edge, and again, I'm going very near the edge, but I still want to get a full thickness bite there. Grasping the needle and pulling it through. Now this is the vertical mattress suture. As you can see, look carefully, it really everts the skin edges. And this helps for a good closure within the dermis. Now I'm going to show you an instrument tie, which is good in this situation when you want to conserve suture and not use your hands to tie. You always want to place your needle driver between the two sutures. Place it here, and you're going to wrap the suture around, grasp the end, and you're going to pull gently. You don't want to make this first tie too tight. You always want to keep about 10 to 15 centimeters between the incision and where you're grasping the suture. This end should be about 3 to 4 centimeters, quite short. Again, needle holder goes in the center, suture turns around, we grasp the end, and now we pull it the other way. We're trying to make a square knot. Leave this hand on this side, switch it around, grasp, square knot. This in the center. And again, you want to do about 6 pulls or complete knots with this suture because it's monofilament and it will slip. It's like fishing lure, but finer. Again, you hold both the sutures up for someone to cut and about the same length. You can see in this that the edges are very well everted in this situation.